My name is Takizawa from Sapporo Kinenta Hospital, Japan. Thank you very much for giving me this great opportunity to make presentation here. It is great honor for me. Today I'd like to introduce about the activities in gastrointestinal endoscopy study group GIESG of Japan Clinical Oncology Group JCOG on behalf of this group. I have no conflict of interest. First of all, I'd like to mention a little bit about JCOG. JCOG is a multi-center clinical study group for cancer treatment fully funded by the National Research Grants in Japan. Its primary mission is to establish and advance standard treatments for various types of cancers. In order to achieve this mission, we are conducting a variety of multi-center multidisciplinary Phase 2 or Phase 3 trials that combine various modalities such as drugs, surgery, radiotherapy, and endoscopy. As of 2021, JCOG has approximately 50 trials open to accrual and 40 trials on follow-up. The Gastrointestinal Oncology Study Group GIOSG was established in 1985, and the Gastrointestinal Endoscopy Studies Group GIESG was reorganized from GIOSG in 2011. JCOG currently has 16 study groups covering all adult solid cancers, with each study group having its own participating institutions. In total, JCOG has about 190 active participating institutions all over Japan, with over 740 clinical sites, Shinryoka. We GIESG has 47 active participating institutions all over Japan, and we have group meetings twice or 3 times per year. Until now, we have conducted 8 clinical trials, including 2 RCTs, mostly for upper GI, such as esophagus and stomach, and 1 for colorectal cancer. Today, I'd like to introduce these 4 already published studies. First study is JCOG 0508. Single-arm confirmatory study on efficacy of combined treatment of endoscopic mucosal resection and chemoradiotherapy for clinical stage 1 esophageal carcinoma. Patient with clinically diagnosed as SM1 or 2 esophageal squamous cell cancer was enrolled. After registration, endoscopic resection was performed. Based on the pathological results, patient received the following: no additional treatment for patient with pathological T1A tumors with no lymphovascular invasion, selective CRT delivered to local regional lymph node for patient with pathological T1B tumors with vertical margin negative or pathological T1A tumors with lymphovascular invasion. Definitive CRT with a boost to the primary sites for the patient with a positive vertical resection margin. The primary endpoint was 5-year overall survival of patients treated by selected CRT, and the key secondary endpoint was 3-year overall survival for all patients. This slide shows the results. The 3-year overall survival rate among the patients treated by selected CRT was 90.7%, and the key secondary endpoint of 3-year overall survival among all enrolled patients was 92.6%. The lower limit of 90% confidential interval in both the primary and the key secondary endpoints exceeded the 80% threshold. Therefore, the hypothesis of this study was proven. In conclusion, combined treatment of endoscopic resection followed by the CRT for T1B esophageal squamous cell carcinoma is considered to be comparable to surgery in efficacy. This strategy can be a newly minimally invasive treatment option. This JCOG 0508 study was published in Gastroenterology 2019. Next two studies are aimed at expanding the ESD indication for gastric cancer. JCOG 0607 is single-arm confirmatory study of endoscopic submucosal dissection to expand indication for early gastric cancer. This slide shows the ESD indications for early gastric cancer in Japanese guidelines. The subject of JCOG 0607 was intestinal type clinical T1A without ulcer finding and more than 2 cm, or with ulcer finding and 3 cm or less in size. After registration, ESD was performed. Based on the pathological results, additional gastrectomy was performed for non-curative ESD. The primary endpoint was 5-year overall survival. 470 early gastric cancer patients were enrolled from 29 institutions between June 2007 and October 2010. This Kaplan-Meier curve showed the primary endpoint, overall survival. The threshold 5-year overall survival was set to be 86.1%. With a median follow-up of 73.8 months, the 5-year overall survival was 97%. The lower limit of the 95% confidential interval of 5-year overall survival was higher than the threshold 5-year overall survival. Thus, the primary endpoint was met. This JCOG 0607 study was published in Gastric Cancer 2018. According to the results of JCOG 0607, these expanded indications were changed into the absolute indications. And next trial, JCOG 10091010, was focused on the diffuse type. JCOG 10091010 is a single-arm confirmatory study of endoscopic submucosal dissection for expanded indication for early gastric cancer of undifferentiated type. ESD was performed after patient registration. After ESD, patients are categorized into two groups, undifferentiated type group and differentiated type group, according to the dominant histopathology diagnosed in the resected specimen. Non-curative cases must undergo gastrectomy. Subjects for primary analysis were undifferentiated type group. Primary endpoint was 5-year overall survival in patients with undifferentiated dominant type early gastric cancer diagnosed in the ESD specimen. 346 early gastric cancer patients were enrolled from 49 institutions between February 2011 and May 2013. This Kaplan-Meier curve showed the primary endpoint, overall survival. The expected 5-year overall survival based on the actual age and sex distributions for all eligible patients was recalculated to be 94.9%. Thus, the threshold 5-year overall survival was set to be 89.9%. With a median follow-up of 69.9 months among 275 eligible patients with undifferentiated type early gastric cancer, the 5-year overall survival was 99.3%. The lower limit of the 95% confidential interval of 5-year overall survival was higher than the threshold 5-year overall survival. Thus, the primary endpoint was met. Based on these results, Japanese guidelines have been already modified. The indication for undifferentiated type was changed from expanded indication into absolute indication in newest guidelines. The results of JCOG 10091010 was also published in Gastric Cancer this year. JCOG 1604 was a non-randomized confirmatory trial for the usefulness of endoscopic ultrasonography for diagnosing cancer invasion depths of clinical stage 1A esophageal squamous cell carcinoma. This study was our first study regarding diagnosis. Patients with endoscopically diagnosed T1A MM2SM2 esophageal squamous cell carcinoma were enrolled. After registration, no magnifying endoscopy and magnifying endoscopy were used to diagnose cancer invasion depths. After that, patient received EUS, and then ESD or surgery was performed. The primary endpoint was proportion of an overdiagnosis following non-ME plus ME with or without EUS. Overdiagnosis was defined as proportion of pathological SM1 or shallower regions in those with a diagnosis of clinical SM2 or deeper. This slide shows the results. Adding the EUS increased the proportion of overdiagnosis by 6.6%. EUS reduced the proportion of underdiagnosis by 4.5%. And EUS did not significantly improve the accuracy. So in conclusion, we don't recommend the additional routine use of EUS after non-ME and ME for evaluating cancer invasion depths to determine the indication for endoscopic resection. Recently, the results of JCOG 1604 was published in JAMA Network Open. Finally, I would also like to briefly mention the ongoing trials. JCOG 1207 is a randomized controlled phase 2-3 study comparing EBD combined with steroid to RIC combined with steroid for refractory anastomostic stricture after esophagectomy. Patients with refractory anastomostic stricture after esophagectomy are randomized to either EBD or RIC. Primary endpoint is stricture-free survival and number of dilatations for 24 weeks after treatment. Current number of registration is 121, so accrual will be completed soon with 9 more patients. JCOG 1217 is a phase 3 study of oral steroid administration versus local steroid injection therapy for the prevention of esophageal stricture after endoscopic submucosal dissection. Patient accrual has already been completed, and the final analysis result will be open soon. JCOG 1612 is single-arm confirmatory trial of adjuvant chemoradiotherapy for the patient with high-risk rectal submucosal invasive cancer after the local resection. Patients with high-risk lower rectal SM invasive cancer after local resection received the chemoradiotherapy instead of surgical resection. Primary endpoint is 5-year relapse-free survival. And JCOG 1902 is single-arm phase 3 confirmatory trial on indication of endoscopic submucosal dissection for elderly patients with early gastric cancer. The subject of this study is these orange categories. Primary endpoint is 5-year overall survival. In conclusion, JCOG GIESG has laid the foundation for clinical research in the field of endoscopy and has created a lot of evidence. We would like to continue to provide useful evidence to the world in many clinical settings. Thank you very much for your kind attention.